Finals SAQ52, local anesthesia for shoulder surgery. A. Which specific nerves must be blocked to achieve effective local anesthesia for shoulder surgery? First is the supraclavicular nerve from C3-C4. For awake surgery, would either need to perform superficial cervical plexus block or infiltrate around the posterior port side. Area supplied by this nerve includes the skin above the clavicle, shoulder tip, and first two intercostal spaces anteriorly. Next is the upper lateral cutaneous nerve of the arm, which is a branch of the axillary nerve from C5-C6. This supplies the skin over the deltoid. The medial cutaneous nerve of the arm, which is a branch of the medial cord of the brachial plexus from C8-T1. This supplies the skin of the medial arm and axilla. The suprascapular nerve from C4 to C6. This supplies the acromioclavicular joint, capsule, and glenohumeral joint. The axillary nerve from C5-C6. This supplies the inferior aspect of the capsule and glenohumeral joint. And the musculocutaneous nerve from C5 to C7. This has very variable input. B. What are the possible neurological complications of an interscalene block? This includes phrenic nerve block or damage, stellate ganglion block or damage leading to Horner syndrome, spinal anesthesia, epidural anesthesia, direct nerve damage of any of the nerves intended to be blocked, causing temporary or permanent neuropraxia, strings or cavity formation in the cervical cord due to injection into it resulting in paraplegia. C. Outline the measures available to reduce all types of neurological damage during shoulder surgery. Nerve damage is a risk during any operation and may occur in relation to nerve blocks, GA, surgery and positioning. Nerve block. Adequate training and experience of the anesthetist. Minimize risk of infection and neurotoxicity using full asepsis and use of 0.5% chlorhexidine spray air-dried. Minimize risk of neuropraxia by using ultrasound, performing the block in an awake patient, having appropriate needle length, and low pressure injection. Or avoid nerve blocks altogether. GA. Risk of hypotension causing reduced cerebral blood flow, especially if deck chair position. Ensure adequate filling, appropriate use of vasopressors and leg elevation, and avoid excessive depth of anesthesia. Positioning. Reduce risk of neuropraxia by careful positioning, padding to avoid peripheral nerve compression such as the ulnar and common peroneal nerve. Avoid excessive stretch on the brachial plexus in deck chair or lateral position. Surgery. Risk of contusion or traction and laceration of nerves. Axillary nerve is close to the inferior shoulder capsule and is particularly vulnerable. This is minimized by appropriate training and careful technique. Risk of brachial plexus injury by arm manipulation. Minimize manipulation of the arm. For further information, kindly refer to the video Perioperative Nerve Injuries. Chairman's report. 69.2% pass rate. Question was answered well. If open question is asked on the possible neurological complications of a block, then this will include damage to both peripheral and central nervous system. Answer to Part C required an account of both anesthetic and surgical factors that would reduce neurological damage, including avoiding interscalene block in the first place. The diagram of the brachial plexus and relation of the brachial plexus in the root of the neck is included here for completion. Thank you.